My name is Mary O'Grady, and presenting the Antenatal Screening Kit with me is Shashira Nagesh and Sean Monagle. And with our team of CBID students and working closely with JPIGO, we have developed a revolutionary technology to screen women in developing countries for high-risk conditions during pregnancy. Every year, 6.3 million pregnant women and children die from complications during pregnancy. 99% of maternal deaths occur in developing nations, and studies have shown that motherless infants are 10 times more likely to die prematurely. Now, these deaths can largely be attributed to the limited access that women in developing countries have to antenatal screening. Now, antenatal screenings are the regular checkups that a woman should receive throughout the course of her pregnancy. Without this regular checkup, a woman may never know that she has developed one of the high-risk conditions, such as eclampsia or diabetes, that can cause complications during her pregnancy. In developing countries, 32% of women have no access to antenatal screening. And if you look at the rural regions of these countries, this number can be as high as 80%. Regions that have the highest percentage of women without access to antenatal screening also have the highest percentages of women at risk from dying from preventable complications during pregnancy. For example, in sub-Saharan Africa, a woman's risk of dying from a preventable complication during pregnancy is 1 in 31. That's compared to 1 in 4,300 in a developed nation where antenatal screening is available. The problem simply is that it is not feasible for a woman to miss an entire day of work to travel to a clinic to receive the screening that would tell her if she had a high-risk condition. And a woman will not seek care unless she knows that her life or the life of her child is in danger. Therefore, there is a need to bring the screening directly to the woman. Once the woman can be screened, and if she is tested positive for the condition, she can travel to a hospital and receive the treatment or have treatments administered there, because treatments are available. For example, one of these high-risk conditions is eclampsia, and while many of you may have never even heard of eclampsia, it is the second leading cause of maternal death worldwide, causing nearly 600,000 deaths every year. Treatments are available for eclampsia, anemia, and several other high-risk conditions. However, without proper antenatal screening for these conditions, the life-saving benefits of these treatments go unrecognized. But there's another challenge besides simply bringing the treatment directly to the woman. The cheapest and simplest current technology for screening for these high-risk conditions is the urine dipstick. But at a price point of 20 to 40 cents per test strip, it is simply too expensive for developing countries to use in the rural regions. But now I'll hand it over to Shashira, who will tell you about our amazing technology and how it's able to solve both of these problems.
Thanks, Mary. Our solution is the Antenatal Screening Kit. This is a novel method to deliver these screening kits at a price point of half a cent per test. This is a comprehensive kit which contains key features that the woman needs to be screened for during her pregnancy. We identified these conditions through our clinical immersions in India, Tanzania, and Nepal, and also through valuable input from JPIGO. The cornerstone of our technology is in the form of this simple pen. You can feel free to join us at our booth upstairs to take a closer look at this. Instead of ink, this pen has reagent filled in it. These are commonly used reagents to screen bodily fluids for various chemicals. This pen is designed to be used by a community health worker who is a minimally trained worker that travels village to village, providing basic medical care. The antenatal screening kit in this way addresses the two challenges of accessibility and extreme affordability. To take a closer look at our technology, the community health worker would tear out a piece of filter paper provided by us, mark on this through our reagent pen, and provide this strip to a pregnant woman, who then urinates on the strip. A dichotomous color change indicates that the woman is positive for the condition that she is being screened for. The community health worker then either administers simple treatments on the spot or helps the woman get to a peripheral health facility where she can seek further medical attention. Our screening kit features 7 key tests and also filter paper booklets. The pens, as you can see here, have two colors on them. The color of the body of the pen indicates the color of the reagent as it is dispensed on the filter paper. The color of the cap indicates the color of a positive test. The kit also comes with pictorial instructions for use. This way, our kit can be easily used by even a semi-literate healthcare worker. The protein pen screens for protein in the pregnant woman's urine, which is indicative of preeclampsia. Our preliminary field studies in Nepal with 400 samples indicate a sensitivity of about 62% and a specificity of about 99%. Since then, we have worked to improve the sensitivity of this test. Glucose in the pregnant woman's urine is suggestive of gestational diabetes. We're in the process of optimizing the color uniformity and the threshold stability on this test. Urinary tract infections are screened for by detecting nitrites in the urine. Our preliminary bench data indicates a sensitivity of about 86%. In order for us to effectively deliver a reagent from the pen onto a piece of filter paper, we have explored various delivery platforms. Some of them include the felt tip marker, which you see on the top left, manufactured for us by a manufacturer in Thailand, sprays, inhalers, and crush markers. Some of the factors that we've considered as we came up with these mechanisms include thermal and photostability, moisture resistance, and color uniformity. Our current design is a ballpoint pen, similar to a whiteout marker, and we've cornered in on this design after looking at uniformity of the dispensed volume and ease of use. So far, I've spoken to you about our technology, and I now hand it over to Sean, who will also tell you how this technology is sustainable.
All right. Thank you, Shashira. Now, not only were we tasked with the technological development of the Antenatal Screening Kit, but we had to explore ways to make it a sustainable technology in developing countries. Now, our kit offers two primary models of sustainability. The first concerns countries such as Nepal and many countries in sub-Saharan Africa, where healthcare is completely subsidized by the government. In these countries, government and donor programs will be able to afford widespread distribution of these screening tests to the millions of pregnant women that need them. The second model concerns countries such as India, where healthcare is not completely subsidized. In these countries, healthcare workers are often self-employed and act as their own entrepreneur. Healthcare workers in these countries will be able to buy our kit and still earn a significant profit by selling an individual test for as low as 1 penny each. And if necessary, these community health workers have available to them the option to take a microfinance loan to pay for that first kit, and should be able to repay that loan and start earning a profit after the sale of the first kit. Now, there's several international forces pushing for a widespread adoption for technology such as this. The first are the United Nations Millennium Development Goals. Now, these were a set of 8 targets established in 2000 by world leaders to improve conditions in the developing world, and 2 of these targets specifically concern reducing maternal and child mortality in developing countries. In addition, USAID, the Bill and Melinda Gates Foundation, and several other prominent organizations came together just 2 months ago to create the Saving Lives at Birth initiative. Now, this is a special program specifically designed to fund technologies that have the potential to reduce maternal mortality in developing countries. Now, to look at the addressable population, every year there's 130 million births worldwide, of which 118 million take place in developing countries. Now, the World Health Organization recommends that all women in developing countries should receive at least 4 antenatal care visits during her pregnancy. However, it's estimated that about 90 million women do not receive this minimal level of care, and this is the number of women that we believe can benefit from our kit. Now, our kit has the potential for a huge healthcare impact in the developing world. Working with JPIGO, we will first target those initial countries that have the greatest need for antenatal screening. With JPIGO and their other partners, we will continue to increase distribution of our health kit throughout the developing world and have the potential to be screening up to 38 million pregnancies within a few short years. Our kit also has several areas for expansion, such as adding simple treatments to the kit, such that community health workers can not only screen for these potentially fatal conditions, but can possibly administer a treatment right there on the spot. There's also several screening tests that could be added to the kit down the line. There's also room to expand the population screen buyer kit. Some of our tests could easily be used to screen the population at large for anemia and diabetes. So we could potentially have a market of up to 3 billion people that live on less than $2.50 a day that could benefit from our kit. Now, just a short summary of the grants and recognition that we've been awarded, the most honorable of which was last fall we were awarded the USAID Development Innovation Ventures Grant to conduct field studies on our protein screening tests. Now, this was a special grant created by USAID at the request of Barack Obama specifically to fund potential game-changing technologies for developing countries, and we were one of the original awardees of this grant. We've also been recognized in Time magazine, and Popular Science gave us a 2011 Invention Award, and we're actually going to be featured in the June issue of Pop Sci magazine, so make sure to check that out next month. We also figured, why should the U.S. projects get all the funds? So we decided to enter some business plan competitions as a social enterprise, and we actually fared fairly well. We entered 3 competitions, the highlight of which was receiving the best social venture at the Rice Business Plan competition, which brought home about $30,000 in cash and prizes. We also placed first at the Johns Hopkins Business Plan competition. In total, we've been able to raise over $150,000 in grants and awards for this project. None of this would have been possible without the support of both JPIGO and the CBID program here. You all have been invaluable to the success of this program, and I just wanted to thank you all right now. I also wanted to acknowledge the original 2008-2009 design team. So this whole project actually started off as an undergraduate design team project to begin one screening test. I was actually part of that original design team, and I think we have a few other members in the audience right now. Millie and Steven, are you back there? Raise your hand. So I just wanted to conclude, I wanted to leave you with this. 99% of maternal deaths occur in developing countries. Clearly, there's something wrong, and we're not the only ones that think so. A recent quote says, "I don't want to live in a world where nearly 1,000 women die in childbirth every day. Every woman, whoever she is, wherever she lives, should be able to give birth without the fear that she's going to lose her baby or that her baby will lose her mother." Now, this was said by our very own Secretary of State, Hillary Clinton, just 2 months ago at the launch of the Saving Lives at Birth program. The Antenatal Screening Kit is a solution to one of the major problems plaguing maternal and child health in developing countries, and we do have the potential to prevent millions of unnecessary deaths from happening every year. I'd like to thank you for listening to me this afternoon. I'd like to open up the floor for questions.